Hi everyone, I'm Dr. Mohal Banker from Banker's Vascular Hospital, and today I'm going to talk about the high flow vascular malfunction. How I treat the high flow vascular malfunction, I'm going to show you details about the planning and how I treat it and what is the end results. So let's have a deep dive for the high flow vascular malformation. So there are two kind of vascular malformation. One is a slow flow and second is a high flow. So what is the difference between that? In a slow flow, the blood flow inside this vascular malfunction, the blood vessels carries the blood. The velocity of the blood flow is very slow. So it may remain stagnant there for a long time. But when we are talking about the high flow vascular malformation, then the velocity of the blood inside these vascular malformation blood channels are very high. So anything you inject inside this vascular malfunction of high flow variety, it will travel very fast. So the treatment differs into these both the types, and that's why it's very important to differentiate between the slow flow and high flow. तो सबसे पहले हम ये जानते हैं कि वास्कुलर मालफंक्शन का नाइडस क्या होता है. So nidus is a Latin word. It means a bird's nest. So just like a bird's nest, there are multiple small blood vessels are intercommunicating and it will form this vascular malformation. Now the problem is that the inner lining cells of these blood vessels has a mesodermal characteristic. What does it mean? That means it has a very high growth rate. And this growth rate is provoked by increasing the repeated trauma. So trauma occurs because of the surgery, because of the external some factors, and it will increase the growth rate of this nidal cell. Another factor which leads to increase the growth rate of nidal cell is a hypoxia. That means reduce oxygen supply to this blood, this intimal cell, and blood. This the cell feels that now they are going to die, so they will increase the production or growth rate. And the hypoxia may occur because of this injection of glue and sclerosant, because these glue and sclerosant will block the lumen. So what happened if anybody inject the glue within this vascular malfunction, the blood vessels will shrink. So temporarily, the size of the vascular malfunction reduce, and temporarily patient feel that the size in the reduction of the vascular malfunction. But ultimately, these nidal cells are alive and they feel hypoxic, and ultimately the growth rate of that nidal cell will increase, and ultimately it will lead to the recurrence. So what is the ideal way to treat? So ideal way to treat is to destroy this nidal cell. So this is very important to understand. Whenever we are treating the vascular malfunction, we have to treat the underlying root cause, and the root cause is the nidal cells, uh, not the blood flow of this vascular malfunction is not a root cause. The root cause is the nidal cell, and we have to target the nidal cell. Just like routinely, the malaria is very common in India. So to treat the patients of the malaria, we should not target the fever. We should not give the only paracetamol, but actually we should target the pathogens which leads to the malaria. Similarly, for vascular malformation, we have to target the nidal cells of this vascular malformation, that it will give the permanent cure. So how can we target this nidal cell? That is very important question. So let's have some look into the another slide. So targeting nidus is um, by the 100% ethanol. If you inject the ethanol, 100% ethanol within the nidus, so this ethanol will destroy the nidal cell and it will give the 100% good results. Now the problem with the ethanol is that you need to be expertise to inject the ethanol. Why? Because ethanol will destroy the nidus and it will give the permanent results, but more the dose of ethanol can lead to the local and systemic circulation complication, and these complications are very dangerous. So one need to expertise to inject the ethanol within the nidus. And second thing, it requires a multiple sittings. See, now in India, this both the player. One is a Virat Kohli and second is Rahul Dravid. Virat Kohli plays very very fast, and Rahul Dravid, he is we used to call him the wall savior. He used to play very slow. So both are the great cricketer. But when we are injecting the ethanol, we have to adapt the style of the Rahul Dravid. We have to inject the very slow. And if we inject very fast, if we inject very high dose of ethanol, then it will create a more and more complication. And uh, ultimately, our aim is to give benefit to the patient, not to harm the patient. And that's why uh, interventional radiologists are the best to treat the vascular malfunction, because they understand the imaging, they understand how to inject the ethanol. So, and for vascular malformation, ultimately, you need to have a high volume centers to learn how to inject the ethanol. By treating a one or two case in a year, you are not able to uh, 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 you are not able to understand how to inject the ethanol into nidus. So, uh, ethanol emulsion is the best way, but you need to train yourself to inject the ethanol into nidus to prevent complication into the patient. So now the method of injection of ethanol. So it should be injected directly into the nidus, whether it's a slow flow or high flow. But in slow flow, there is an advantage is that the when we inject the ethanol into the nidus, it will remain there for such some time, because the velocity of the blood itself is very slow. So first we inject the contrast. We have some approximately idea of the nidal volume and then contrast clearance rate, and according to that I inject the ethanol within the slow flow. But when I injecting this ethanol into the high flow vascular malfunction, it's a very different ball game. Why? Because of velocity of flow inside this high flow vascular malfunction is very high. So whatever you inject into the nidus, within a fraction of second, it will go into the distal circulation, and there is a very minimal effect into the nidus by the ethanol into the high flow. So first we have to convert the high flow into the slow flow by putting the coils. And after after converting into the slow flow, we can inject the ethanol just like a criteria of the slow flow vascular malfunction. So this is very important to understand that one has to convert the high flow into the slow flow, because to have a maximum effect of ethanol, ethanol should be stayed there for at least 60 to 90 seconds into the nidus. So these are Dr. BnG classification. He is a pioneer in this field, and he has shown this technique into ethanol emulsion to the world. And he has classified the vascular malfunction nidus into these four types. And why this classification is very important, because uh, these are different kind of nidus, and we know by understanding the type of nidus where when to inject, at where to put the coils to convert the high flow into the slow flow. Like if we take this type 3A and 3B, so these are the ideal point to inject the to put a coil, and then once we put a coil over here, then the high flow becomes the slow flow, and then we can inject the ethanol. So this is how BnG classification works. So now let's have this practical look. This is a patient of vascular malfunction into the high flow vascular malfunction of the foot. And when I've done the angiography, you see the multiple well, high velocity flow over here. And there are, it seems like there are multiple nidus over here. So now uh, I've done the selective angiography and into the selective angiography, uh, you are able to see the single nidus and this outflow tract. All right. So there may be the multiple nidus, but this artery shows the single nidus over here and this outflow tract. So as I've shown you, there's a into this BnG classification. If we block this outflow tract, then we can convert the uh, these high flow into the slow flow, right? So now have a look on how I inject how I put these coils into this high flow vascular malfunction. So first, there is a direct puncture of the nidus. So previously you've seen the contrast coming from over here, but now with this single needle, I've I've taken the excess of the nidus. Once I confirm that my needle is within the nidus, I've started deploying the coil over here, and you can see this is a needle and one small this attachment from the needle. This is a metallic coil. This is what I'm injecting within the nidus, and uh, proper insertion of the coil is very important. So for proper insertion of the coil, it's we have to judge how many coils is required to block this nidus, and exactly the coil should be inserted into the outflow tract so we can convert the high flow into the slow flow. So this is how I create the dam into the river by injecting this coil. The flow of the nidus will reduce, and when once I put a sufficient coil, then I can inject the ethanol. So I've taken the two nidus over here. There is a one coil is over here and second coil is over here. These are needle of this both nidus. And now let's talk about this nidus. Once I've confirmed that this high flow malfunction is converted into a slow flow, then I've injected ethanol, and these are negative contrast effects. So these are white. You can see over here into angiography, and these are ethanol. So ethanol, we are able to see this is traveling into the nidus, not going distal to this. And this is very important to understand that once we convert the high flow into the slow flow, then we can inject the ethanol very comfortably and to reduce the complication. Now see the end results. So this this angiographic image I have shown you into the before starting the procedure, and you can see over here there's a large amount of high flow. These outflow tract, these are multiple nidus, and I've targeted this two area over here. I would inject. I would put the nid to. I would put the coils into two nidus and then injected the ethanol. And after injecting this, the uh, the amount of flow, if you are able to see over here, the amount of flow is significantly reduced over here. So the two nidus is already blocked. Still there is a remaining, but the amount of ethanol what we have injected, it's sufficient for the one sitting. So we'll take care of another nidus into the next sitting. So in conclusion, absolute ethanol embolization gives a permanent solution for the vascular malformation because it destroys the nidus. Interventional radiologists are the best super specialists to treat the vascular malformation, and this is very important thing. This is not 2020 match. You cannot play this is a cricket. Yeah, in cricket there's a two format. One is 2020 match that in this format you have to score very high because the number of overs are very less, and the higher the score, the winning chances increase. But and another format of cricket is a test match, and there is a 5 day format. You have to play very slow. You have to preserve your wickets, and by preserving that, you can you can score very high. So the cricket is the same. The format is different, and in ethanol also. Uh, these are test match. These is not a 2020 match. You have to inject the ethanol when slow come amount, so to reduce the complication and give the maximum benefit to the patient. So thank you so much for listening this talk. If you have any kind of question, do ask me. I would be very happy to answer your all question. Thank you.